Endoscopic brow lift is one of my most favorite procedures because it can really make a beautiful impact on how the eyes are framed, bringing more openness and brightness to the eyes by reshaping and repositioning the eyebrow. Endoscopic refers to using a high-tech piece of equipment, a telescopic video camera. So think of a long tube that transmits a video signal, and I can place that telescopic video camera through small incisions, typically in the temple region, so it's completely hidden by the hair, and then navigate under the anatomy by looking at a TV screen and going underneath to navigate safely the nerves and all the blood vessels in that region. Endoscopic technique requires a certain skill set that not all surgeons have, but I love using it because we can work through very small incisions and get beautiful shapes to the brows. Now, typically patients who have lateral outer brows that are drooped, that are framing the eyes in a more downward appearance, giving the eyes a bit of a fatigued or sad appearance, can really benefit from an endoscopic brow lift. And the idea is if we release the attachments, ligaments that are holding the outer brow and the corner of the eye region in the current position, and then reposition by lifting up and setting the anatomy in that position, then we can really create this beautiful natural effect of brightening the eyes. Now we have to know exactly how much to lift and what direction to lift, and so when we consult before the operation, we will do a simulation where we find exactly what that aesthetic target is we're aiming for, and then I will reproduce that in surgery. Now, oftentimes I combine an endoscopic lateral brow lift with a little lift to the corner of the eye. That's called a canthoplasty or a canthal release. The lateral canthus is the outer corner of the eye, and by doing that, then everything can come up gently to create a little bit of tilt to the eyes. Now, we have to be very conservative here and not overdo anything, really, but just a little bit of lifting to the corner of the eye can give a much more attractive and naturally refreshed appearance. Now, recovery is not terrible at all. It's a few days of having a bit of a headache, feeling, but easily controlled in pain medicine. Bruising, swelling is fairly mild in the eye region, and it's an outpatient surgery, so you don't have to stay overnight in the hospital surgery center. Typically, patients flying in from out of town will stay for about a week, and then they can fly home safely. 2 to 3 weeks after surgery, you look relatively normal. Full results come in a matter of 6 to 8, 12 weeks, and it only gets better from there. This is the most reliable technique, much more powerful than a temporal skin-only tightening because I'm really lifting the deep structural layers, and that's what makes this technique very effective, and it lasts for effectively permanently. So endoscopic brow lift is a wonderful technique to brighten the eyes.